low-resource settings. We look forward to our engagement as we work together to identify and overcome common challenges and advance the global response to AMR. Thank you so much to the team of the Quadripartite and for your commitment to this critical issue, and we look forward to a productive and insightful session today. Thank you, and over to you, Chineri.
Thank you very much, Ivan. I will hand over the floor to Professor Lothar Wheeler, who is the Chair of Digital Global Public Health at the Hassno-Plattner Institute, to also deliver opening remarks. Over to you, Lothar. Thank you.
Yeah, good morning, good afternoon, good evening, distinguished colleagues, friends. It really is a privilege to address such a unique audience, bringing together policy advisors and scientists, because tackling antimicrobial resistance requires exactly this kind of cross-sector collaboration. One Health integrated surveillance of antimicrobial resistance and antimicrobial use is not just a technical concept, and that's very important. It is a cornerstone of the global response championed by the Quadripartite and prioritized by the Global Leaders Group on Antimicrobial Resistance. It also stands as a key research priority within the Quadripartite One Health agenda on AMR. Actually, at its core, integrated surveillance is about one thing. It's about delivering data for action, not data for reports that sit on shelves, but data that enables evidence-based decisions, informs policy, and ultimately reduces the risks and impacts of antimicrobial resistance at the local, national, and of course also the global level. To strengthen this effort, the Global Leaders Group established a dedicated task force on integrated surveillance, which I had the honor to lead. Our mission was clear: to elevate high-level evidence-based advocacy and to improve communication across sectors, bringing the gaps between stakeholders, policymakers, enforcement communities, and the scientific world. From this work emerged a practical tool, a pocket guide on integrated surveillance for political decision makers. Developed jointly with the Quadripartite, it outlines why integrated surveillance matters and what actions are needed to make it a reality across sectors. It also helped pave the way for the Quadripartite's technical guidance on One Health integrated surveillance of AMR and AMU, which means antibiotic use of antimicrobials. Now, let me turn to the most important part, the call to action. Each of you in this room plays a critical role. Whether you are shaping policy, conducting research, or supporting enforcement and compliance, your work directly influences how effectively we respond to the huge challenge of AMR. Together, we must drive the implementation of integrated surveillance systems. We must mobilize the necessary resources, and we must foster collaboration, not only across disciplines, but across borders. For policy advice in particular, your role in regulatory enforcement, monitoring antimicrobial use, and supporting compliance frameworks is essential. For scientists, your expertise ensures that the data we rely on is robust, actionable, and meaningful. It is not a scientific activity only. It is at this intersection where evidence meets enforcement that real progress happens. Don't leave it for publications to be put on the shelf. Today's discussions offer an opportunity to align our efforts, identify priorities, and explore how we can build or expand systems that are truly integrated under a One Health approach. Looking ahead to upcoming high-level meetings and technical guidance developed by the Quadripartite should serve as a roadmap, helping us create surveillance systems that are interconnected, interoperable, and resilient enough to meet the challenge of AMR. I encourage all of us to engage properly, openly, think across boundaries, not thinking selfish, but thinking about the outcome, what we want to achieve, a reduction in AMR and antibiotic use, a specific, fine, adjusted reduction. And we have to focus on solutions that are both practical and scalable. I very much look forward to a dynamic and impactful dialogue ahead. Hopefully we all have a good and productive time. Thank you so much for listening.
Thank you, Dr. Houtin and Professor Wheeler, for your words, which not only reiterates the objectives and the focus for this webinar, but also emphasize the importance of discussions such as today that should spur us literally into action in order to achieve joint deliverables, working collaboratively across all levels and across sectors. I would just ask to share the screen so that we can very quickly touch on the agenda for today. And then without just reading through, we have gone through, the next point is to go into a series of presentations which will not only showcase how the guidance was developed, but also give insights, leveraging on the content of the guidance to explain a little bit more to our audience here, the roadmaps that are contained in the guidance and the recommendations therein. So next, I will call on Dr. Delphi Gochez of the World Organization for Animal Health, who is also part of the core group at the Quadripartite Joint Secretariat, who supports the work on integrated surveillance. Dr. Gochez, the floor is yours.
Thank you very much, Inere. Well, welcome to everyone to this webinar. We are very pleased to have you all here from the different sectors and different organizations or institutions that you represent. And it's my pleasure today to start this presentation on the background of this guidance. Next, please. Just to state, because this document has been developed by the Quadripartite, and just as a background, the Quadripartite Joint Secretariat on AMR. This is a work, the Quadripartite is being coordinated by FAO, UNEP, WHO, and WA. And we are working to reflect the joint work and approach of One Health. And this was established in 2019. And there are main activities that we want to achieve with this. One is the support of global promotion, advocacy, and political engagement. Another one is support the global governance and structure, the coordination as well and monitoring of Quadripartite strategic plan and work plan implementations and mapping gaps and opportunities. And for sure, to support countries in the implementation of national action plans and AMR following a One Health approach. Following this, this is the work, the task that's been put for the Quadripartite, and we are trying to develop all these activities. And I will briefly present what are the tools or resolutions, the global resolutions that we have. So next, please. One of these, and most of you, I think you are all aware of this, is that we had a political declaration from the United Nations in the General Assembly, or UNGA, high-level meeting in 2024 in November. And during these meetings, there were several commitments for the different sectors that under the One Health approach for AMR. But it was the first time that we were having commitments that were referring to integrated surveillance and analysis. Commitment 98 was the strengthened national capacities for sustainable sector-specific, integrated and interoperable surveillance systems for antimicrobial resistance and antimicrobial use. And commitment 99, while it's specific for every sector, but it was mentioned through all the sectors that already existed, is to encourage all countries to report quality surveillance data on AMR and AMU by 2030 through the existing global surveillance systems such as GLASS, Animus, and Inform. And the discussion that we are also having in the core group, which is the Quadripartite GISA that is under development. Next, please. Thank you. We also have other type of works that we are doing. One is the One Health Priority Research Agenda that you see below, which is an integrated surveillance approach on, for the quadripartite, where we are prioritizing research areas through AMR. And the other one is the Global Leaders Group on AMR, Surveillance for Action. And what this group is doing is to advocate for improved surveillance and monitoring of AMU and AMR across all sectors to inform ambitious science and risk-based global and national targets and interventions to address gaps in response to AMR. Next, please. So one of the questions that we were having is what is happening around the world regarding integrated surveillance, and the information that is available for everyone and also for the quadripartite is through the global database on tracking antimicrobial resistance country self-assessment survey, which is called TRACS. This has been implemented already for a decade, and some questions have been input recently to reflect the track of certain interventions, such as integrated surveillance. And this is the survey from 2025, so from last year. And all countries that you see here in the map in blue are countries that are saying that they have already established or that they are starting the implementation of integrated surveillance systems for AMR. Countries in red are those countries that have stated that they have not been doing this work or the work has not been established yet. So this is giving us some baseline information for our work, and this is very essential for the global picture that we have so far. Next, please. Also, when we were discussing what is the information that we currently have available, is that we already having different systems through the quadripartite organizations. For example, on there, if you see from left to right, starting from WHO, we have GLASS. And what this global system is collecting is AMR and AMU data from human sector. Then you see in orange from the Organization for Animal Health, from WOA, we are collecting antimicrobial use in animals. Then you see the next one is FAO through InFarm that has been recently established a couple of years ago. And what they are collecting is AMR in animals and AMU in plant production and protection. Then we are in discussions as well with UNEP. They are part of the quadripartite, and they are envisioning to have a system for AMR and residues in environmental health. So the three systems that already exist and the system that is foreseen for the future. This is from the quadripartite, and this is what we will have in the future as GISA. So the Global Integrated Surveillance Systems for AMR and AMU that hopefully will be available in the future for everyone, where we will be putting AMR and AMU data from the different sectors, which would be publicly available. Next, please. So before giving the floor to Jap, just would like to tell you that the guidance that has been published on One Health Integrated Surveillance on AMR and AMU is publicly available. If you are registered for sure for this workshop, you already saw that in the registration, you already had access to the document itself. And above, you see all the quadripartite colleagues from the core technical group that were involved in the publication of this document, but also we had experts around the world, as Professor Sabiha and Professor Jap as well, that are in this meeting and had supported. There were a group of experts, and what they were doing is providing advice and guidance in the development of this document, and to provide context-appropriate regional and country-level systems for the integrated analysis. They also supported the quadripartite in the development of this specific guidance. So I will pass the floor to Chiniere in case you would like to properly introduce Professor Yap. Thank you very much.
Thank you so much, Dr. Goches, for setting the stage. Without much delay, I will now hand over to Professor Yap Wagner, who is the Chair of Clinical Infectious Diseases at the Utrecht University. Yap will introduce us and also provide an overview of the guidance, touching on the overarching purpose, scope, and target, and also, more importantly, give us a definition for integrated surveillance and the reason why one or a nation or an organization might want to embark on establishing or expanding their One Health integrated surveillance systems. Over to you now, Professor Wagner.
Yeah, thank you, Tinere. Good day for everybody. And I'm honored to give a few introductory slides to the guide. Can I have the next slide, please? So first, the purpose of the guide was to present a context-appropriate and technical feasible proposal for countries to coordinate and establish a national integrated surveillance system for AMR and AMU. And also to set strategies to contain and to control AMR development and spread in the One Health sector. It was what Lothar already said. We are looking for the evidence-based data to take action. Next slide, please. And when we look to the scope of the guide, that is that countries should initiate integrated surveillance programs in at least 2 One Health sectors, with, of course, the intention to extend and to promote collaboration and coordination at various stages of the integration. And I think we cannot enough stress the words collaboration and coordination. I think they are really crucial in the integrated surveillance, that sectors, that they talk to each other and that they exchange the data. Next slide. And second slide is about the scope is what One Health sectors we are talking about. That is humans, that is healthcare, and that's community settings, animals, and including the derived products, and that's also terrestrial and aquatic animals, plants and crops, including their derived food products, and the environment. And the environment is really wide, so that is hospital, that is wastewater from the environment, and it's more the wider environment. So that's really a broad scope. And then we are talking about the One Health interfaces. And the interfaces, very nicely depicted in the figure there at the right hand, is where the different sectors, where they overlap or intersect. And that are the crucial points where transmission and spread between the sectors take place. So that is, in fact, that is really a basic thing of the integrated surveillance. Next slide, please. And then the target audience. As you see, it disappeared. It was a lot of text, what you can find in the guidance. And most important is that you will do a stakeholder mapping. That with all the people you are working with, setting up integrated surveillance, that you identify them from the different sectors, in slaughterhouses, in animal practices, in hospitals, in the environment. And that list is almost endless. That's why I thought I would put it in that disappearing slide, because it's really also up to you, up to your country, to really do the right selection of people. Next slide. And then the definition, the cliffhanger. It's the continuous, collaborative, coordinated and systematic collection, collation, validation, analysis, interpretation, communication and sharing on data of AMU and AMR from humans, animals and products, and plant and crops and the products and the environment. As you see, we were in a whole group, 25 people, and everybody has some words that we want to have in that definition. And I think this is really what it is about. And then the word continuous. And although surveillance, I know surveillance by definition is a continuous activity. But I was happy that Chinere said what is said is the opinion of the different presenters, is that I'm flexible with the definition of continuous, because I think when you sit together with people and when you have a smaller data set that has an beginning and an end and is not ongoing continuous, I think you can be already proud of what you have, and you can start with talking with the different sectors what you see and how there is probably a connection between the different sectors. It's also like the in-farm system that the group from FAO is running, preferably large data sets, but also they say, be proud of what you have and share it with us. So I think for me, that is the same. Don't become paralyzed by the fact that you think this is something too big for our country because we are not sure if we collect data next year. Sit together and do the things that are described here with all these different words. Next slide, please. And then the objectives. That is to provide information on patterns, trends, and potential associations. And when we keep in mind, I thought, as an example, for example, the colistin resistance that popped up, we can use it as an example where I think all the objectives of the integrated surveillance that it fit, because there we saw that there was a certain pattern of increasing colistin resistance and the associations between the usage, and also there was found that it was in animals and in humans. So that fit with the first bullet. Then second is support and inform risk analysis for AMR. And that was also with colistin. So what are the risks? Then alert authorities about the emerging and re-emerging AMR and changes in patterns of AMU. That was also fitting with colistin, where in different sectors you should the association, you should coming up. And then inform the development and assess the effectiveness of interventions to address AMR and improve public health and sector-specific outcomes. And that was also with colistin, where we said in some countries there is a ban of colistin, and when you see the effect of that, at least in some countries there is evidence that you have a reduction of colistin resistance. But the ultimate goal is to reduce the burden of AMR-associated infections and preserve the efficacy of antimicrobial agents in all One Health sectors. Next slide. That was it. Thank you for your attention.
Thank you very much, for setting the scene and introducing the primary concepts of the guide, including what the focus is and the objectives for which nations might begin to undertake or expand their existing surveillance systems and begin to think about integration. The next speaker will be Dr. Jorge Mateo, who is from the Governance, Coordination and Monitoring Unit of the WHO AMR Department. He's also a member of the core team for the Quadripartite core team on integrated surveillance. Dr. Mateo will share examples of integrated surveillance from country and regional perspective and do a bit of a deep dive into how to establish or considerations to put into place when establishing or improving systems for One Health-based integrated surveillance, priority setting, and some of the key things that we would like you to take away from the webinar concerning the content of the guidance. Over to you, Dr. Mateo.
Thank you. Thank you very much, Chinere. Hello, everyone. Thank you for joining to this launch of this important guidance on integrated surveillance. What I would like to share with you is that how a part of what we use to develop this guidance is something that has been developed for the different quadripartite organization for a long time. And now we use all these tools and guidance that we have to develop something that can put all these approaches together and help countries to establish and implement this integrated surveillance system. So we have the WHO IGSAR guidance on integrated surveillance in the food chain, the Codex AMR compendium that is including the guideline on integrated surveillance, the aquatic and terrestrial codes and manuals from the World Organization for Animal Health, the manual for the implementation of in-farm from FAO, and also the model of integrated surveillance called Tricycle Protocol. So using all these, but also using some existing experience in countries establishing this integrated surveillance. We have all these examples from some specific countries and also at regional level in the case of the European Union. All these systems are focused on in the food chain, but it's important to take these examples to build the system and establish this national integrated surveillance system. So the JACRA report is the European Joint Interagency Antimicrobial Consumption and Resistance Analysis. And in this case, JACRA is including the two components, AMR and AMU. CPARS from Canada is also including AMR and AMU. That map is one of the oldest system collecting data from animals, food, and humans. They are also collecting data on AMR and AMU, and this system is also now moving to the One Health approach. Then we have Maran and NEFMAP from the Netherlands, also collecting data from AMR and AMU. And last but not least, NARMS from the US, where this system is a collective effort from US FDA, US CDC, and collecting data only on AMR. But this is the different approaches that we can use to establish and guide countries to establish the integrated surveillance system. What you will find in this guidance that we are launching today, it's important to mention, and some of my colleagues also mentioned, that this document is an overarching document and it's a living document. We consider that there are a lot of work that and evidence, important evidence that we need to also include in the integrated One Health surveillance systems. So as Jap shared, you will find the definition of this One Health integrated surveillance system. I will show also and share with you some types of integrated surveillance systems, the data collection needs, some of the requirements that are needed from laboratory, but also for epidemiology, and also the options for integrated data analysis, interpretation, sharing, and communication. This is one of the big tasks that we still need to work. And also is a need, as also Dr. Wheeler mentioned, it's not just to collect data and share the data at global level. It's also to create the ownership of the data and use the data. The data is for countries for action. So that's why this part of integrated data analysis, interpretation, sharing, communication is one of the work that this quadripartite group continue doing, and is part of the work plan for future guidance for countries. Let me share with you some of the approaches that we include in this guidance, how countries can consider to establish this system. If the country has already sector-specific surveillance systems, they can start from this approach. You know that one of the main challenges is how the capacities and resources to conduct surveillance. So we don't need to duplicate. This is not a recommendation. The recommendation is to use what is existing in the country, if that is existing. If not, the country can use the best approach to start the surveillance per sector that they are interested to include in the integrated surveillance. For the other side, there are also some examples to build a system from zero, from a totally a new integrated surveillance system. So in this case, let me share the approach A, when the country has already sector-specific surveillance system, in human sector, animal, plants, crops, environment, and including the two components, antimicrobial resistance and antimicrobial use. And maybe the country is already participating in the different global surveillance system, GLASS, INFARM, or ANIMUS. And from this approach, the country can establish the system. And the most important, as Jaap mentioned, is what exactly the system is going to bring evidence to support the implementation of national action plan, to bring evidence to impact and contain AMR at national level. For the other side is if the approach B is to build a new integrated surveillance, we have two models. One is to create or establish a sector-specific system in humans, animals, plants, and from this, establish the common approach and indicators to integrate the data from the different surveillance systems. And the model two is, for example, the country can use one specific model. In this case, and the best example is the tricycle model, which is based on one indicator. And this indicator is samples are collecting from humans, from the animal sector, and also from the environment. Is one of the models that already is including the environment. It's a simple indicator and is easy for countries to establish in some way the first step for a national integrated surveillance system based on this indicator. Moving from the models and types of how the country can establish the system, we also include important stages that country can establish when they are going to implement the integrated surveillance. The stage one, which is the most important, the situation analysis. And this situation analysis, you can see that include different steps to analyze all the resources and capacities per sector to establish how the system can be built. So from conducting the situation analysis, planning, resourcing, and stakeholder mapping, to establish the priority settings, the epidemiological design of the system, and also how the data is going to be collected, shared, analyzed, and used. To the stage two, to go directly to the work of the integration on data sampling and data collection, analysis of these samples, data analysis, the results of these samples, interpretation, reporting, and communication, and of course, the monitoring and evaluation of the system. So here, what we are including here is how the country can go from the situation analysis to formalize the establishment of the system. But something that is important and Jaap mentioned, and it's something that has been also highlighted in the different countries that are implemented integrated surveillance. When we talk about One Health and multi-sectoral work, the most critical points to consider by countries is the integration, the coordination, the collaboration, how the different sectors are going to work together. So the success of this integrated surveillance depends on this synergistic, coordinating, alignment from the different sectors. Of course, the resources, governance, and legislative capacities to really have the impact that we have, and the data that we are collecting will have an impact on the actions to contain AMR. Then you can also find some setting priorities from the population of interest in different sectors, humans and animals, species to be considered part of this integrated surveillance, plant crops, and here is also including food, because I saw already questions about food, but when we talk about One Health, we are talking about all sectors. It's not all sectors are included here. And of course, environment that also Jaap mentioned is still challenging, but we are working in collecting more evidence to guide countries in the implementation of surveillance in the environment. Then the location also per sector, the microorganisms that we consider can include in the system. And from here, you can see that we are taking here as example the approach of in the food chain. from Salmonella and Campylobacter, or indicators as the tricycle, which is the Escherichia coli. And also the resistant mechanisms and antimicrobial that will be considered as a part of the system. Then also in antimicrobial use from, for example, in the case of the human health sector, the medicine level data at national level, clinical data, or in the case of the animal sector at national level, and how this data is going to be collected and compared with the AMR data. So this is the different components, priorities. You can go and find more details in the guidance. Then I would like also to share how this coordination should be established. And this is talking about governance of the system based on the different country and regional examples. We suggest these approaches to be considered by the countries. So the approach one is the intersectoral integration. That means that all sectors are working together. They are collecting data and they are doing a joint integration, working in this case, the four sectors and the two components, AMR and AMU, as a group coordinated the national integrated surveillance system. So all sectors are involved, coordinating again, coordination is key, and integrating the responsibilities. This is not a problem of the human health sector. This is a problem of all sectors. So it's important to define, but the national authorities, in this case, could be the multi-sectoral coordinating mechanism to define and establish how will be the governance of this system. So the approach one, all sectors are working together and integrated the data, analyzing the data, and preparing the report. And the approach two is that the national entity, the national level, the establish an entity that is going to collect the data from the different sectors. And this entity, this national entity, is the one that is collecting, analyzing, and reporting the data. This is also an option for the country, but this is the two approaches that we consider based on the different examples in countries that could be part of the analysis on how to establish this governance of this system. Last but not least, as Dr. Wheeler mentioned, exactly integrated surveillance, any surveillance is providing data for action. This is exactly the definition. So in this case, when we talk integrated surveillance, we can see that all these outcomes that we can have when we establish this integrated surveillance can inform local, national, and global action. So that's why we are providing this guidance. You can go in details. What is this actions that can be informed by this integrated surveillance system? And of course, depends on what exactly is the question that the country is going to formulate to establish this multi-sectoral integrated surveillance system. Thank you very much. And moving here to my colleague, Alejandro Garcia Dorado from FAO.
Thank you, Jorge. And yeah, I don't know if there was going to be transition from Tinere, but I will continue the presentation in the segment of presentations to update on the next steps and the quadripartite work plan for implementation of the One Health integrated surveillance. Now we are moving from a conceptual alignment. So what my colleagues were explaining before is how we conceptually align of mechanisms of implementation. And now we are moving from that to operationalization. How are we going to operationalize this integrated surveillance over the next years? In the quadripartite, we have developed this work plan that focuses on translating the One Health integrated surveillance into practical tools, guidance, and activities that are going to support countries. And the emphasis is no longer on why the integration matters and how we can integrate elements, but how we can actually implement it in real systems. And for these reasons, we have positioned a set of complementary products that are here in the pipeline. I would like to start with the three foundational products that we would like to develop in parallel in the coming years. The first product is to develop guidance on integrated data analysis, interpretation, and use of the data, utilization of this data to ensure that once the data are available in different sectors, that can be translated into meaningful risk-based insights for decision making. This is very important. There are already examples from some regions, like for example, the JARCA reports from other integrated systems that are also available in the guidelines that were published. But we would like to go into the technical details on how to do this integrated data analysis, how to approach it from the ecological perspective, how to approach it from the epidemiological perspective as well, to understand how these relationships works between AMR and AMU. The second product is we would like to focus in how to compile country case studies, capturing practical experiences from implementation, so that countries can learn from each other and they can also adapt approaches to their context. One of the key principles for integrated surveillance is that it needs to be context specific, it needs to be adapted to each specific context in the countries. So that's why we would like to focus on these case studies. And this is like a living resource that I'm going to deep dive a little bit more in the next slide. The third product is a questionnaire. We would like to develop a small questionnaire for assessment of the infrastructural and human capacities to provide a baseline on where countries stand, to identify the key gaps in the systems, key gaps in the workforce, and also especially gaps in coordination across the different sectors. Then, if resources allow, if times allows, also we are also moving into the other three products in the coming years, which is the generation of evidence gathering and synthesis in these interfaces that were presented before in the One Health spectrum, the overlap of sectors. We can develop products and deep dive in some of these intersections. Then also the implementation of whole genome sequencing and how to incorporate these whole genome sequencing and metagenomic approaches into integrated surveillance. And finally, we are also going to go into the revision of the tricycle protocol for ESBL's detection across different sectors to make it more actual and also to expand it over the coming years. Next, please. So a key priority for us, as I said before, is to capture real-world experiences from countries that are already implementing the One Health integrated surveillance. And I am highlighting this product. This was the product number 2, actually, in the previous slide. I'm highlighting this in particular because I would like to actively invite all of you. I mean, there are here many experts, many people around the world from many different contexts, and we would like to invite you to contribute with your experiences. Also in this webinar, through the interactive chat, but also if you have something to share, success stories, but also challenges and lessons learned, if we can compile this in case studies, we would like to invite you to participate in this, because ultimately what we need is real examples from real systems and from realities in the countries. Through this compendium, we aim to document practical approaches, challenges, and solutions, and also identify what works in which context and why. And this work is initially being advanced through the multi-stakeholder partnership platform action group on integrated surveillance. And it will also to ensure that there is more stakeholder engagement. But our intention is to create this living resource. We would like to compile case studies accessible through the Quadripartite Joint Secretariat website, which is here. And we would like that this website is live for updating information, updating case studies, a resource that continues to evolve as more countries contribute and learn from each other. So we very much count on you for collaboration and to make this actually a truly useful platform, a truly useful place to share experiences. Next, please. Then I would like to move also on the new framework that we are working on. I would like to move to the GISA, the Global Integrated System for Surveillance of AMR and AMU, which will also serve as the framework under which we are going to operate moving forward in the coming years. We are developing GISA through a systems approach. It's not just a platform, it's a combination of a web-based application, tools, guidance, knowledge sharing mechanisms, and also capacity building activities. What we would like to bring is to bring these elements and be designed to support countries in implementation of integrated surveillance, and also in the future, enable integrated analysis of data at country, regional, and global levels. GISA is representing the global integrated surveillance architecture that brings systems across different sectors, as my colleague Delphi from WOA was explaining before. It connects antimicrobial resistance and antimicrobial use in human health through the GLASS system, antimicrobial use in animal health through the ANIMUSE platform in WOA, antimicrobial resistance in animal populations, food, but also non-food producing animals in food and food systems, and antimicrobial use and antimicrobial resistance in plants through the in-farm system, and also environmental data through the UNEP-led initiatives. Importantly, each of these systems, the Animuse, GLASS, in-farm, and activities on UNEP, will continue and retain the mandate and the governance, but GISA will enable the integration of these systems to bring cross-sectoral insights, stronger and more comprehensive risk analysis, and more informed policy and decision-making at national, regional, and global levels. Next, please. And just to finish, just to explain what we are actually currently doing in GISA, we are in the initial stage of development of GISA. We had a previous phase in which we were aligning and conceptually aligning data models and infrastructure. Now what we are moving is in focusing on bringing together the existing data and the data streams from these key systems, from GLASS, Animuse, and in-farm, in a common data repository. What we would like to do is not just to create a new data system for now. What we are doing is leveraging and connecting data that already exists. The immediate objective is to enable the visualization of AMR and AMU data across the sectors. And in the future, once this repository is established and we are able to visualize data from WOA and in-farm next to each other and also GLASS, then the next step would be actually to do a progressive integration and potentially also analysis and interpretation across these data streams, if feasible. And then that's all from my side. And thank you very much, Chinere and colleagues. And I just go over to Chinere because we concluded the segment of presentations. Thank you. Thank you very much.
Thank you very much, Alejandro, and thank you to all the colleagues who have presented this set of slides where we did a bit of a deep dive into the guidance and the plans that the Quadripartite has for implementing integrated surveillance in countries. Now we move to our interactive discussion session, focusing on, again, as Alejandro mentioned, moving to beyond conceptualization to operationalization within countries. So we have a panel discussion session, which will be shared by Professor Sabiha Esak from University of KwaZulu-Natal, Durban, South Africa. We also have distinguished panelists who include Dr. Muna Abusin, Dr. Benjamin Kisi Sasu, Dr. Carolee Carson, and Professor Heike Schmidt, who will be looking at specific questions centered around how best to leverage and maximize opportunities to operationalize One Health integrated surveillance while acknowledging the challenges and also sharing country-level examples of how those challenges can be overcome. So over to you now, Professor Esak, to lead us into this discussion. Thank you.
Thank you very much, Chinere. So good morning, good afternoon, and good evening, colleagues. Thank you to all of the previous speakers for giving us such a comprehensive overview of the new guide. We have come to the interactive panel discussion on operationalizing One Health integrated surveillance of AMR and AMU. As highlighted in the Quadripartite guidance, AMR is a quintessential One Health challenge, spanning humans, animals, plants, and the environment, and requiring a coordinated and multi-sectoral response. Integrated surveillance sits at the heart of this response, enabling us to understand transmission dynamics, tracks trends, and inform evidence-based interventions across the sectors. This session is designed to move us from guidance to practice, drawing on existing real-world country experiences. So Chinere has already introduced our panelists, and I'm delighted to be joined by the 4 distinguished panelists, each bringing practical experience from different country and sectoral contexts. Their biographies are being posted in the chat now. So each panelist will have approximately 3 minutes per question, and I encourage concise, experience-based reflections. We'll then open for brief interactions across the panel and then the audience. So I note that many of you have already been putting questions in the chat, and the Quadripartite colleagues have been answering them, but we will save a few questions for the panel discussion, time permitting. So let's start with the first question. The first one relates to core challenges We know that while the concept of integration is widely endorsed, implementation is far from straightforward. So let me begin by asking each of you to reflect on the real-world challenges. That is, what are the most significant practical challenges your country has faced in implementing One Health integrated surveillance of AMR and AMU across sectors? And perhaps, Dr. Muna Abusin, we'll start with you.
Thank you, Sabiha, and hello to everyone. Sometimes the challenges are not the most obvious ones, and sometimes they are, in fact, very the basics. And from the German perspective, we seem to have quite everything in place to implement an integrated surveillance. So mature sector-specific surveillance systems for antimicrobial resistance and antimicrobial use with well-established workflows, standards, feedback and reporting lines. Also, there's always room for improvement, but we quite know our different data sources, and we also know how to use the data and indicators for actions, which has been mentioned previously, how important really to focus on that in the respective sectors. Coming to political momentum and commitment. In 2022, during Germany's G7 presidency, integrated surveillance was high on the political agenda and entered the G7 Health Ministers Communique. We hosted a dedicated technical meeting and exchange among experts from G7 countries to strengthening our integrated surveillance approaches and share best practices. And we too were impressed by the Canadian colleagues' experience and expertise and maturity of the Canadian Integrated Program for Antimicrobial Resistant Surveillance. Stepwise approach. We were and are still part of small and large-scale projects in the One Health context at the national and the European level, featuring, among other topics, integrated surveillance. We also had, for example, some seed funding for doctoral fellowships to strengthen collaboration and understanding across sectors. One of those focused on a joint analysis of surveillance data from different sectors. Policy. The implementation of an integrated surveillance system is part of our national strategy and our national action plan on AMR. In the first step, we aim to establish a joint portal and web page linking the surveillance data from all sectors. Only if you start and go concrete, you will face the specific challenges, barriers, and limitations within your context, practically but also structurally. After Germany's G7 presidency, the responsible agency from all sectors, altogether 5 agencies, established an informal network to regularly exchange, discuss, and advance the work on an integrated surveillance system. That was back in 2022. Some very practical questions arose along the process. Who is going to host the web page? Who puts the funds, time, and resources on the table to develop, implement, and maintain it? Who is speaking and communicating on behalf of the group? This is important, sometimes overlooked room and space between well-established sector-specific systems. And this becomes quickly linked to questions around the need for an official mandate and governance structures. So our challenge is not primarily capacity within sectors, it is the governance and financing of what sits between them. Being fully conscious that concrete challenges will differ considerably from region to region and country to country. And I will stop here. Over to you, Sophia.
Thank you very much, Muna. You have highlighted the importance of political will, collaboration, coordination, and communication, the 3 C's of the One Health document, as well as learning from good practices such as the Canadian experience, which brings in the capacity strengthening aspect of the One Health strategy. So thank you very much for that. I will go on to the next panelist, Dr. Benjamin Kisusasu. Would you like to give us your perspective from Ghana, please?
Great. Hope you can hear me.
Yes, we can. Thank you.
Great. So for Ghana, with the great support from Fleming and MPTF in terms of having integrated surveillance, we are going to go far. Currently, we have harmonized our SOPs. So we have one document, a guideline that has both what the human, animal, environment, and forest, even as plant health aspects. And we have looked at the gaps in terms of some SOPs that the plant environment needed, which they have also done for them. And we are able to have a system whereby a data system which I think last week the official handover was done to the Ministry of Health, which is the coordinating center. And they have also put in a kind of a team. And first, we had a challenge. It was more of only human health expertise that have allowed the various sectors to bring in experts to be part of the data. You know, data is currency. So once other sectors don't see part to see where the data is coming from, they tend not to generate. So at the coordinating center, we have reps from different animal, from different sectors available. And one thing we have done is with our AMU, Food and Drug Authority, for human and animal get a lot of data on in terms of the antibiotics that comes to the country. They have a system which we are looking at giving a linkage to it. That's the big bottleneck right now because we're depending on them for that system to come. And they have had there was a change in government, new management. The IT infrastructure from that side is delaying, but should it be done very fast, we would get data on our AMU quite easily. And with the various labs, yes, everybody is doing well because there's FTP in the various labs that sends data. The biggest challenge is resource constraint. In Ghana, because of where we find ourselves, when there's when the resource comes, the little resource comes, it is more directed towards human health, gets more of that resources. And that's a big challenge. And that will if you don't take care, when we are doing surveillance data, we realize that humans have a lot of data versus animal health and environment. The good news is that we have done our first national report, surveillance report, which will be launched very soon, looking at about 4 or 5 years data. And just being part of the committee, we saw that human health is leading. And this is evidence of the kind of resources that they have had. We also realized that there was a language barrier when we were looking at what the data into the system will speak, because what AMR data will be seen in human may be different in terms of interpretation with animal and with different environments. But we are looking at how we can do joint works and data will could speak easily, not always waiting for genomic data. Currently, the system doesn't pick genomic data, which in a few systems will. So some of the challenges have been the data system indicators. We are going to give some indicators across all the three sectors, and that may hamper some sector-specific indicator that they may need. Because if you look at the infam, it may have some indicator that will help the animal sector, but because we are doing harmonization, we may forget about those indicators. So we have made that be brought to bear so that they could look at it. So and also we are looking at the district and the regional level involvement. It has always been more of national coordinating, and though some regional labs are being part, it is not fully owned, which is a big challenge. And all this is because of resources to get them. Another big challenge is the quality management system. You know, for a laboratory to get better data, are you going to get all the labs being going KMS compliant? So these are our challenge. But good news is that it's a step in the right direction as we have a system picking data. With time, we can be correcting and see how we can link AMU, AMR, AMC. Thank you.
Thank you very much. I particularly like to commend the very considered way in which you're dealing with this in developing the standard operating procedures across all the sectors. And we do realize that human health surveillance is far more advanced all over the world, but you have already put into a mechanism in place to ensure that the other sectors also come up to speed, and starting with AMU, which perhaps is lower hanging fruit than AMR surveillance at this time. I agree with you that resource constraints will remain a challenge, especially in LMICs, but you also highlighted the important aspect of data interpretation, because what data means and how it is interpreted in one sector may be very different from the other, and so we need to have a sort of a standardized or harmonized way in which we have to deal with this. So I then turn to Dr. Carolee Carson. Please give us the Canadian perspective. Over to you, Carolee.
Thanks very much, Sabiha. And thank you to you all. Good morning, good afternoon, good evening. My comments will reflect experiences from the Canadian Integrated Program for Antimicrobial Resistance Surveillance, or CPARS. And when we launched in 2002, we were quite honestly only barely able to call ourselves an integrated surveillance program. We had 4 components when we started: human salmonella, salmonella from diagnostic samples from animals, 4 months of active sampling from healthy animals at abattoir, and some human antimicrobial use data. 3 of these 4 components were from building or expanding existing infrastructure. And in the case of the human sales data, it was by asking another department nicely. And we did all of this on what we could be doing, basically on a shoestring budget. And one of our earliest, greatest hurdles was the absence of routine communication across sectors, with external sectors and even within the federal government itself. Collaboration doesn't simply materialize. It has to be cultivated. It requires recognizing and creating opportunities for connection, committing the time to show up and engage, and maintaining the consistency needed to build trust across disciplines and sectors. And while it can be somewhat straightforward to calculate the resources needed for equipment, laboratory supplies, and personnel needed to run samples through a lab, what we didn't originally anticipate was the amount of time and effort for engagement. A significant portion of our time has and is invested in building and maintaining networks that make true integration possible. What we learned is that you have to show up in ways that make you real and accessible. As Jaap had mentioned, sit side by side, meet in person if you can, host webinars so that people can see the human being behind the data, and be consistent. So for example, for the past 15 years, we've had informal but monthly telephone or video call presentations or meetings, bringing together science and policy colleagues working across antimicrobial resistance from across 6 federal departments. This started out as a Friday afternoon phone call between just 2 of us and has grown into a standing invitation of about 100 people. That type of regular communication can help with another challenge we had, which was organizational barriers. Agencies involved in antimicrobial resistance and use surveillance often operate under different mandates. Some are regulatory bodies, others focus on public health, others on research, others on industry support, others on animal health. These differing mandates shape priorities, timelines, and expectations. And what counts as useful data in one sector may not meet the needs of the other. So aligning these perspectives is not a small task, and again, it requires trust and sometimes negotiation. So the absence of meaningful regular communication and differing mandates across the One Health sector participants in our surveillance program, these were very real challenges for us when we started out, and we were a small group of people. There were just a handful of us. But despite this, we feel that these challenges can be overcome by taking the time to collaborate to develop cross-sector partnerships. Thank you.
Thank you very much, Carolee. It's interesting that for me that you have now a mature system that began with one bacterial species and built on existing surveillance programs. So it was one small step at a time, and you're now 100 people strong in terms of your team. So I also want to highlight the fact that you spoke about collaboration and trust that needs to be cultivated, and also the importance of networks and communication to yield true integration. So really good lessons to be learned from the CPAS program. Professor Heike-Schmidt, from your perspective, please.
Yes, thanks, Sabiha. I hope you can hear me. Welcome to everyone. To start personally, my personal expertise lies within the environment sector. And I've been working on surveillance in the environment in the Netherlands, but also in many bilateral collaborations, as well as in the tricycle projects. And also momentarily in Europe, there are quite large collaborative networks of government agencies called joint actions. And also there guidance on specifically environmental surveillance is developed right now. So I'd like to bring in a perspective from many countries, not only from the Netherlands, and specifically for the environmental sector, because I think that the environmental sector has specific challenges that are a bit different to the other sectors. And one of those challenges is a common understanding of the issue. Often we see that institutions that are involved in environmental protection are well familiar with protection of water, from, for example, chemical pollutants and general fecal pollution, but not so much with antimicrobial resistance. Also, there can be less of a history of collaboration between institutions from the environmental sector and the other sectors, the human and animal sector. So it takes even extra time to develop a common language, a common understanding of the concepts, and also of the jurisdiction of the involved stakeholders. The second challenge, as also mentioned already, is institutional responsibilities and mandates, including for financing. Because for AMR, the ultimate protection goal is protection of human and animal health through less infections with resistant bacteria, but environment, for example, from hazards such as pollutants. However, first actions on AMR and the environment have always or often been initialized by public health institutions, including in the Netherlands. Thus, it's often not immediately clear which institutions are responsible for AMR in the environment. And as it has been laid out that the mandate should lie within the environmental institutions, but often that needs a intense collaboration with the other sectors. And maybe a third challenge could be named perceived lack of evidence on the relevance of the environment in particular. There's still limited knowledge on the actual role of the environmental sector in the development and the transmission of resistance. Therefore, questions are often asked on what kind of involvement of the environment sector is necessary and adequate. But we still lack this information to judge to which exact extent environmental transmission is relevant and should be taken into account to tackle the problem of AMR. However, once we have established systems of surveillance, these could well be used to establish the data that is needed to help determining the role of the environment. So to conclude, environmental surveillance is currently still being developed in many countries, also internationally. And the Quadripartite guidance will greatly help countries in taking first steps. And so I hope that in a few years' time, we probably have many more examples and also experience to draw and to refine our approaches here. Thanks.
Thank you very much, Heike, and thank you for highlighting the under-recognized importance of the environment in the integrated surveillance. And you're quite right that as we pilot more of the projects, we'll be able to bring in the environment more concretely and show the value of also extending surveillance of AMR as well as residues within the environmental sector. I know that we are close on to time, and I want to go on to the next question. When it comes to the second question relates to, sorry, there we go. The second question relates to solutions. So we've heard about the challenges. This is where the implementation becomes actionable. The guidance highlights that integration does not necessarily require building new systems from scratch, but rather leveraging and aligning existing ones. So in very short responses, what practical steps can governments take to maximize existing resources and strengthen sector-specific surveillance within a One Health framework? When I think about governments, I'm actually speaking about the ministries and as they're implementing parts of the governance. So Mona, can I go back to you, please, in terms of maybe one or two solutions?
Yeah, I think, we have already, when we touched the challenges, I thought we already heard some of the solution as well. And Caroline, she brought it as well out, the communication and coordination bit, and really the consistency as well. We have to be conscious. It's not an automatism or a guarantee that even if you have robust systems within sector, this leads automatically to an integrated surveillance approach. And I think we still need to make a better case for integrated surveillance, and that is also the reason we are here today. And besides generating the data, it touches also economic aspects. What are the costs and what are the benefits? This is policy. And I think it is important that government supports the concept and related activities, and that has been said already previously, including exchange and discussions at all levels of our system, institutions and organizations, the technical, the policy, the management at the senior leadership level. And countries can and should build on experience from other countries. And within the forehand networks, formal and informal, they have in place and are part of, and re-examine their frameworks, strategies, legislations, and funding resources. And last but not least, this point I would also like to highlight, they need to be aware of and identify potential entry points when new developments are emerging, such as overarching digitalization strategies at the national or regional level, respectively, to conserve and maximize resources. Back to you, Sabiha.
Thank you very much. So you really highlight again the importance of learning not only internally within the country, but also externally from other successful projects around the world. Dr. Kisosasu, if you could just provide an LMIC perspective in terms of surveillance, especially as the Fleming Fund is now, has closed its doors. Please, over to you.
Great. So for us coming from LMIC, we need to look at existing systems and collaborate. So let's take like animal sector is planning of surveillance to slaughter facilities or farms. It's good to collaborate with environmental department. So when we go, maybe we use only one pickup. They get a team to join us. Once we pick our samples from the animals, they can also pick the environmental samples. With that, we don't need another team to go at a different time. Then when the samples are brought, we save on transportation. We get to even get a good data because now the data coming from the environmental sample and that of the animals can be linked easily. On top of integration, not just waiting for the data, but even hope you can hear me. Hope you can hear me.
Maybe switch off your camera, Dr. Sasu.
Yeah, can you hear me now?
Yeah, yes, we can hear you. We can hear you.
Great. So sorry, so just to continue. So we can reduce cost even in our sampling because we don't have a lot of resources instead of sitting in silos. So human people can decide also to go to a certain place for samples. They can tell the other sectors. Then maybe environmental may be interested. Maybe they want to pick effluents from the hospital or the community places. So we reduce our budget. And also another area is it's good that the limited laboratory infrastructure we have, we sit down and prioritize them. So it doesn't mean that every sector should have the same type of equipment, but the equipment can be open, which Ghana started with. Then the veterinary labs help the environmental department authority with their samples because they don't have a lot of labs in the country. And that is better than waiting for donor to get another lab because cost of QMS, cost of the machines, maintenance, and calibrations are huge costs. So it's for we in the low middle country to look at existing structures and making sure that if there is even budget for another department, we can all channel to maintain what have been given to us because our donors are going by a little money. So it's about looking at the systems and the integration should be seen at even planning for sampling, going to the field, not just waiting for the data set and want to integrate. And also another part is professional training, which I know developers can provide, maybe an online course, so that every year we could remind ourselves about data integrity. Because when trust is lost, I'm sure people who are in the value chain will not be ready to give out data. Thank you very much. This is what I propose to come mind.
Thank you very much. Very, very important propositions from an LMIC context. And I like the idea of leveraging existing infrastructure and making sure that there's data integrity at all stages and perhaps repurposing or extending the functions of existing laboratories. So thank you very much. Carolee and Heike, I'm going to ask for 2 quick interventions from both of you, starting with Carolee first.
Thanks, Savia. I'd like to begin with the importance of strengthening sector-specific surveillance. AMR system is undeniably complex, but integrated surveillance doesn't have to be, as Jaap had alluded to earlier. One of the most valuable lessons we learned was start simply and simply start. And as I mentioned before, when we launched, we barely qualified as an integrated system, but even that modest beginning created momentum. And strengthening surveillance within each sector often starts by showing people the power and the value of even limited but good quality data. and by being willing to face the tough questions that inevitably follow. It wasn't easy to stand in front of stakeholders and explain that we knew what was happening in one region but not another, or that we lacked farm-level surveillance in one sector but not another. And even now we're running into the same thing with our water sampling in only some areas. But every one of those difficult conversations was a sign of engagement. People asked hard questions because they were interested, because they saw value, and because they wanted more. That kind of criticism is not a setback, it's leverage. When someone points out a gap, they're telling you that the information matters. They're giving you a concrete rationale to seek funding, expand capacity, or strengthen a particular component of the system. Instead of being discouraged by criticism, use it as evidence of demand and as a momentum for growth. And in terms of a practical step resulting from this is the willingness to stand up and share good quality data, results, and information, even if they are not perfect in terms of scope or coverage. My second message, a more somber but unmistakably clear message, is that surveillance systems cannot function on unstable foundations. Many programs still rely on short-term project-based funding, but surveillance is not a project. It's continuous by design and nature, ongoing. So to ensure continuity, governments must embed resistance and use surveillance within structures supported by stable, predictable financial mechanisms. Core surveillance activities should be protected as much as possible from things like routine untargeted resource reallocation or attrition. It doesn't mean surveillance programs should escape scrutiny. They definitely should undergo periodic, pre-planned expenditure reviews as part of routine monitoring and evaluation. Reviews that assess efficiency and relevance without jeopardizing essential operations. Because what often gets overlooked is that the networks and relationships underpinning an integrated surveillance system are themselves valuable assets. They require time, consistency, and trust building, none of which can be captured in a simple dollar value. Surveillance cannot be turned on and off like a switch. Every interruption in surveillance erodes trust, and rebuilding that trust can take far longer than maintaining it. And I think I'll close there, Sabia, in the interest of time. Thank you.
Thank you very much. Heike, I'm so sorry to do this, but could you possibly give a solution in less than a minute from your side?
I do my best because many things have already been said, which I couldn't agree to, more like building trust through collaboration and the necessity of continued financing. But maybe the last recommendation that is more positive would be dare to start small and dare to focus. Because if you start small, if you start collaborative in a collaborative way, you do build trust through a collaboration as small it might be. And especially for the environment is so wide, consists of so many subcompartments. So dare to focus, choose wisely, use the objectives of surveillance as laid out beautifully in the quadripartite guidance to choose where exactly you want to measure with which purpose. And that can already give you a first data set that you might profit on collaboratively. So maybe that's enough to close.
Thank you. Thank you very much. And apologies again for giving you such a short time. So I know that we're almost running out of time. So I just want to make a few key messages that have emerged. That integrated surveillance is essential but complex, requiring coordination across sectors and systems. There is no one-size-fits-all model. Implementation must be context-specific. Strengthening sector-specific surveillance is a critical foundation. Integration is best achieved through collaboration, data sharing, and alignment. And importantly, countries can start small, focusing on priority interfaces and scalable approaches. Ultimately, as emphasized in the guidance, integrated surveillance is not an end in itself. It is a means to generate actionable data that informs policy, improves interventions, and reduces the burden of AMR across all sectors. So thank you to the panelists and for the insightful contributions. The audience, you have all had all of your questions answered by the Quadripartite core team. Thank you to the quadripartite core team that supported this work, and a very special thank you to Chinyere Okoro for her exceptional leadership and coordination. I now hand back to the organizers for the next steps. Thank you very much.
Thank you, Sabiha, and thank you to the panelists. There are a few ringing messagings that we hope that all the audience will be able to take away from here. To close today's event, I will invite Dr. Jean-Pierre Nyamazi, the head of the Governance and Coordination and Monitoring Unit of the WHO AMR department, and also head of the Quadripartite Joint Secretariat, to deliver the closing remarks. Dr. Nyamazi, please take the floor. Thank you.
Thank you so much. I'll be very brief. As we conclude today's session, I want to thank you for your participation and your support to the quadripartite work on One Health integrated surveillance of AMR and AMU. I will not repeat what the integrated surveillance guidance brings as added value, because experts have made the case very clear. Also, thanks, Carol, to remind us that integrated surveillance does not replace sector-specific systems. So we need to equally continue to invest in those sector-specific systems. I would like now to acknowledge Lotta and the GLG for advocating for this work and helping to keep the momentum and ambition high. I remember in the beginning, it wasn't an easy task. Thank you, Sabiha and Yap, for your technical expertise. Alongside the members of the quadripartite technical group that we had put together. I remember in the beginning there were about 27, and I'm pretty sure a good number of them kept pushing and providing technical value until the end. So really huge thanks to you and everyone, wherever you were. Finally, thank you to our great experts in the QJS core team for your technical leadership and dedication throughout this process. It wasn't easy, as I know, but as you mentioned, the work just starts. So really today's launch is important, but a launch only matters if it's followed by implementation. I think that was really made clear. So moving forward, my call would be just basically repeating to what Lotta said, but I will be even more practical and say, in the coming weeks, not months, not years, I encourage you to convene your national counterparts, if you are at a national level, across human health, animal health, food, environment, and look at the guidance. And Sabia has made it clear, it's not one size fits all. What we are providing today is a guidance. And just deduct your own priorities, assign responsibilities, and identify resources needed for you to move from this guidance to the implementation. And it was made clear the quadripartite organizations and through the Quadripartite Joint Secretariat. So we remain available to support member states, to support all the implementers, to provide our expertise and support as much as we can to make sure that from this guidance to the action is really realized. So again, thanks to you, Chinyere, and all the core team, Yap, Sabiha, the speakers today, the panelists we had, and Lotta, and as well for all of you, the participants, for your attention and your excellent ideas that you shared today, and most importantly, to what you're going to do from tomorrow. Thank you.
Thank you, JP. I would not add much. We would like to thank everyone who has taken the time to join us today and to share all their expertise and experiences. On behalf of the Quadripartite core team, who have been integral and we all worked hand in hand to deliver this work with the support of the experts. I hope you found this session informative. We hope to continue to engage with you and collaborate with you in the future as we deliver on this very important area of work. I hope you have a wonderful rest of your day. Thank you and goodbye.
Thank you.